Adwa TV, bringing good things to life. Adwa TV, bringing good things to life.
So the year is gradually coming to an end, and we may all have our projections or whatever we need to get done in the coming year. But let's not forget that in this year we have had a lot of projections, what we had wanted to achieve. But if we have been able to achieve it or not is also a question needing an answer another day. Today we are the Food and Drugs Authority, and we are going to look at the year under review. We are going to talk about a lot of things, including the progressive licensing scheme, what has been done about it, what we need to do to help push this agenda forward. My name is Nafa Alikwakwa, and this is Regulators. We'll be back shortly.
Blue City is a manufacturer and supplier of high-quality fashion accessories. We design and make quality bow ties, flying ties, lapel pins, ladies' brooches, fabric necklaces, African wares, and so much more for your weddings, schools, institutions, bands, choir, singing groups, individuals, and so many more. We use both African prints and foreign fabrics to make your beautiful accessories for you. Oh yeah! Contact us via call or WhatsApp or SMS on 0240-926-564. Locate us at Odoko Official Town opposite Emils Preparatory School. Check us out on social media, Facebook and Instagram at Blue City Fashion. Blue City, creativity and style.
Announcements on Adwa TV. Contact Adwa TV for your general announcements, proclamations and publications, job vacancies, etc. at a very affordable rate. Call 050-92-57754, 020-9494-258, or visit our marketing desk at Stepwork Premises. Adwa TV, bringing good things to life.
Welcome aboard the safest airline in Africa. With industry-leading safety measures to protect your well-being. The first in Africa to earn a diamond standard of safety. Offering a more contactless, safe, and seamless experience. Delivered with a smile by Africa's first fully vaccinated crew. Creating special memories that bring the joy back to flying, so you can continue making memories with your loved ones. Book your flight with Rwandair today. Rwandair, the safest airline in Africa.
Rwandair, fly the dream of Africa.
morning, Mrs. Apia. Thanks for having us.
Thank you for coming.
Now, every individual or corporate institution have their own New Year resolutions, things they want to achieve in a particular year. Now, the FDA has, over the period, done a lot, but we know that 2021 has not been that easy for us. COVID has set in, there are a lot of setbacks here and there. But can you remind us of your mandates before we delve more into it?
Yeah, thanks for the opportunity. The Food and Drugs Authority, FDA, it's a government agency that has been established by law, which is the Public Health Act 2012 Act 851.
Okay.
And our core mandate is to ensure that and also enforce the standards that have been laid out for the manufacture and sale or importation and exportation of food, drugs, and in the case of drugs, they're referring to allopathic, herbal, and even veterinary drugs. The conduct of clinical trials, the regulation of household substances and chemicals, everything concerning the regulation and control of tobacco and tobacco products also fall under our domain. And we do this by ensuring that we safeguard public health and safety.
Interesting. Thank you so much. But how do you enforce these laws, putting into consideration standards as well?
Yeah, exactly. So regulation can only start when there is effective standards. There are effective standards that have been put in place. For those that we may not have standards for, we are enjoined by law to work closely with the Standards Authority to be able to establish the requisite standards that can stand the test of time and be acceptable across the world, so that whatever we approve here will be fit for purpose, both for use within and externally as well. So on a day-to-day basis, our mandate is to ensure that we ensure that these products that we regulate, at the end of the day, are safe for use, they are of good quality, and that they are efficacious or have good performance in the case of medical devices.
Okay. Now we see these adverts on television. This advert has been vetted and approved by the FDA. Now it has been changed to a quite precise and shorter version of it. But have you had instances where you had to call out or pull down a particular product during this year?
Yeah, sure. So the challenges we faced, in terms of the implementation of our law, has been quite enormous, but has not been beyond our ability to control.
Okay.
Principally, issues about the airing of unapproved advertisements continue to be a bane for us. Unregistered products that come into the country through smuggling and unapproved routes are critical matters of concern to us, because until the regulator is able to ascertain that they are safe and they are of good quality, there is no guarantee for anybody to hazard and use them. So from time to time, we have done our bits by way of market surveillance. We monitor the airwaves and even on social media to be able to ascertain that adverts and claims that are being made on these products are accurate. For those that have not complied with the law, we've had opportunities where we've had to close down some establishments because of unapproved products that are being sold, and even unapproved advertisements of those products as well. So some bit of that has gone on. Market surveillance has led to the seizure of a number of products for safe disposal throughout the year. We are talking about substandard and falsified medicines. They have all been part of the category of products that we have launched severe onslaught on, just to rid the markets of them.
So what are some of the registration requirements or the processes? Let's say I have a small business that produces maybe food items and I want to move on to the next stage. What are the processes the manufacturer or whoever is in charge of it needs to go through?
Yeah, sure. So you basically have to write to the authority.
Okay.
You bring an application form which you can complete online and submit. There are some requirements that come with it, but they are product specific. So depending on the kind of product you want to register, we tell you what the detailed requirements are, but they principally will include certificates of analysis. Some, if they are food products like grains, we expect to have the sanitary reports that will be brought, manufacturers authorization for sale and all. Those are part of the requirements that we expect you to have. And then we will expect that you bring along some samples which will be subjected to laboratory analysis, just to be able to clear them if necessary for your registration processes to go through.
But who pays for the lab testing?
Yeah, so it's part of your application process, and it is highly subsidized by government. Just so, so we are really not looking out for your money, but for the safety of the product for you. So, what people pay is just a little percentage of what goes into the entire cost of analyzing the product and certifying them for.
What has been the other challenges the authority has to face concerning food products or any other thing that you regulate?
So basically, we've had issues with people not registering their food products, and yet we want to sell them out there. For those who might have issues with maybe the cost or the duration of registration, we have been very responsive, and FDA has been able to review its processes, done a bit of risk-based analysis to see how well we'll be able to expedite the registration processes for them, at the same time not compromising on standards. So it has become a lot more easy and cheaper to go through the registration process, and therefore we do not expect that people want to circumvent the law to still do what they want to do. Time and time again, issues about the details of the product, sometimes on the labeling, i.e. the expiration dates and all, sometimes are tampered with, and those become a matter of concern to us. But that's why we have in place very stringent measures as far as market surveillance is concerned. So on a periodic basis, we have teams that go out there to purchase samples of these products and come and subject them to testing, to be able to ensure that what has been registered are actually what are being sold out there on the market. But it has not been all gloomy. We've had great successes as well in the year under review. Yes, we were confronted with COVID all around the world, and national medicine regulators around the world had to grapple with getting solutions and remedies to the situation. We in Ghana pride ourselves with how well we're able to respond to the challenges that we're confronting us. So with the emergence of COVID, our borders were closed, imports were not coming in as you would expect, and so it got our local entrepreneurs working, and we needed to quickly establish the needed standards for them in the case of the manufacturing of sanitizers and face masks. The authority, FDA Ghana, has been able, together with the Standards Authority, establish very good and acceptable standards for the manufacturing of COVID-related products, which have gone quite well and saved the nation a lot of money and resources as far as their production now concerned. They provided jobs to people, which we are so glad to be part of. Again, our laboratory, which is accredited as an ISO lab, has gotten a wider range of accreditation. So we have expanded into cosmetics and household chemical analysis as well, in addition to the medicines and the medical device testing that we already do. We are glad to say that as a result of the work that we do, we are actually, we serve on the WHO boards for certifying these medicines and even the vaccines that we have for COVID now. And through our instrumentality, we have been able to approve, I think, 5 major vaccines which are presently being deployed by the Ghana Health Service.
Can you list these vaccines?
Yeah, sure. So we have the AstraZeneca that came from India, the Serum Institute of India. We also had the Covishield, which is actually AstraZeneca, but the name for the one from India was called Covishield.
Okay.
And then we had J&J, which is the Johnson & Johnson, Pfizer, Moderna, and then the Sputnik V, which has been approved. We have also appealed ourselves as a nation for a round of clinical trials for the Sputnik Light, which is ongoing presently. Again, we have been working closely with the Center for Plant Medicine to go through the processes of clinical trials for one herbal plant which is being tested for as a remedy for COVID-19. It's still an ongoing process, and we trust that we'll get some affirmative response from the exercise.
Now, with the issue of COVID, we realized that it is said that after 8 weeks, you take the first jab before the 8 weeks, and then after 8 weeks, you take the second. But those who have taken the first jab have not been able to do so even after 2 months. So what is the reason? Can you tell us if the first jab is still okay for the second jab to come in maybe later in 3 months or in 2.5 months?
Yeah. So I think that was the case at the early stages of at the early times within the year, where we were not getting sufficient vaccines in the system. But the situation has been solved in a way, because presently Ghana Health Service has been able to deploy various vaccines. We still have AstraZeneca in the hospitals. We still have some Moderna, and we expect to deploy the Pfizer this week also. So there is no shortage as it used to be the case. But even at the time where we had the shortage, studies have actually shown that the wider the space within which you take the first and the second jab sometimes helps to build the immunity even better. So it was not a matter of putting people at risk at all, but to help their bodies to build the necessary antibodies to fight the disease in terms of building immunity. So we've not really had a crisis on hand as a nation, even as a result of the shortage at all, because of the way we've been able to handle it, the adherence to the COVID safety protocols and all, washing of hands, face masks and all. It has helped compared to other nations, and even in Europe, where they are presently experiencing a surge in the death tolls as a result of the pandemic.
Now let's come back to the successes chalked by the authority. We've had a lot of programs, a lot of initiatives. One is the PALS, Progressive Licensing Scheme. Can you give us briefly, or tell us briefly, what it means, what it stands for? Because most of us are having businesses, but we cannot move ahead with it.
Exactly. Okay, so the Progressive Licensing Scheme is actually an innovation and a flagship program of the Food and Drugs Authority. We pride ourselves with it so much because we actually see it as an intervention that comes as a direct response to the President's initiative for industrialization. And we realize that, yes, there may be unemployment on the market, but Ghana still has a potential for growth as far as economic activities are concerned. And it's not just, our market doesn't really lie with just the population within, but across the sub-region. So as regulators, we had to do a bit of introspection and see how we'll be able to respond to the needs of the small and cottage industry. So yes, somebody may be unemployed, but may have a skill and want to start a business. We want to work along with them and give them the assurance that we trust that they can grow from small to big. So we have done this by developing a 3-tier registration scheme process, and it's just a matter of you inviting us to have a conversation. We will come over to your site wherever you are manufacturing your product. We'll look at the facility, we'll look at the products that you are churning out, we'll give you some advice on how to do it according to best practices, and then we give you, if you're able to comply and comply well, depending on the level of compliance, we give you the requisite color-coded certification and also licensing of your facility. And This started last year, June 2020, and to date we are happy to announce that we have over 1,000 facilities and products that have been approved by the FDA using this scheme of certification, and over 500 facilities have also been licensed under the scheme. As a matter of fact, it's a welcome news, because now nobody needs to say they are scared of the standards that have been set in place for registration. We come right over to your place and work with you on along the line, and it's time the shooter manufacturers, the Tom Brown producers, all the people that are manufacturing one thing or the other from your kitchen or from your shed or garage, it's okay. We trust that you will go, and we'll give you all the needed support in terms of regulations, so that you can be able to become a worldwide brand, as it were.
Okay, so who qualifies for the pink, yellow, or the green license?
So like I mentioned, we have, it's a scheme. So depending on the percentage of compliance that you have, it starts from the pink, goes to the yellow or the amber, all through to green, and then you are graduated into a full-blown company.
Okay.
And also, it depends on the level of compliance. You earn yourself some marks, and you are placed at the right level to begin the process.
Okay. Now, when we are sick, we go to the hospital. The doctors prescribe a lot of drugs for us. We are not almost always able to finish the drugs, but we do not dispose these drugs off properly. So that was how come you brought in the T-bomb. I have said a little about it, but I want you to elaborate more.
Sure. You seem to be a good advocate of what you do. So yes, the Take Back Unwanted Medicines, it's a project or an initiative that we had to embark on as a way of showing the way as far as sustainability is concerned. So it's a way of telling the manufacturers or whoever, or anybody who is into any form of sale of any product, that you don't only sell in the spirit of sustainability. You need to be able to think about the full cycle or the full life cycle of the product. So after it is done, it has finished its life cycle, how do you dispose of it should be your concern. And it doesn't only lie with medical products. Even when you're selling computers, you should be thinking about what happens to it when it spoils. If you are not able to dispose it of well, it becomes an electronic waste, which will be to create a challenge for the environment. And also we sought to use this T-BAM or the Take Back Unwanted Medicine as an initiative to show the way, as I've said, and it's for households and families to look into their households and look at the medicines that are no more in use. You cannot just dispose of medicine anyhow. You cannot just pour it down your sink or in the water closet and think that you are done with it, because it's going through the system. It will have an effect on our water bodies, and even to a large extent the quality of life that we get to have. You may just think you are pouring it away, but you may be poisoning some other users at the downstream. So we have put in place special bins in some designated pharmacies. And the idea is to get people to drop their medicines there. We will come and do the necessary sorting and ensure the safe disposal of these products. So far, we've been doing this project in Accra, which has enjoyed massive success, and therefore it has become necessary for us to scale it up and expand the scope to cities like Takoradi and also to Kumasi. So very soon we are rolling out the second phase of the T-BAM project, and we are going to make sure that it receives a lot of awareness and cooperation from society. We will be in the central business districts of these cities, so the Kotokwaba market, the market in Takoradi, we will be in Idum, make sure that people are aware that FDA is
Something
coming
is
for
happening.
medicines that you do not need in your households. And then we create a whole lot of bars, even for, you don't be surprised to see the bin even in the banking hall, if it's possible. So it's not a matter of you saying, I don't go to pharmacy. We make it well available in every part of the cities we are talking about and make sure things go well. So that's what we have in mind.
So if I want to dispose of a medicine today, would I be charged for it?
No, it's for free. It's
Okay.
actually for free. To be our joy to see people walk in and drop their medicines.
But how often do you go out to dispose of from these
From the
pharmacies?
pharmacies, I think every month we do the inspection to see whether the bins are full. Then we take them out and put in new bins. So we just think that awareness is what we need to create, because the avenue for this submitting or to send this are quite wide. It's a matter of letting the general public know how Ghanaians can be very compliant. The moment they know, they will support the cause and things like that.
How has it been in Accra? I mean, it's been a while.
Huge success. It has been a huge success, and that's what is informing the scaling up of the project now. So the shops or the pharmacies that have these bins have done a good job of sensitizing their clientele base to bring back the medicines they do not want or do not have need for.
Now the third major one is the SF campaign. I don't really know much about it, but I would want you to also explain again.
It's okay. So WHO, the World Health Organization, has come up with a study which has revealed that not all the medicines we have on the market really meet the standards. Some are substandard. In other words, the active ingredients or the active components of these medicines do not meet the required standards, and therefore no wonder sometimes they are unable to give us the relief that we want when we are sick and we take them. Others are also false. They are actually fake. They do not have any form of active ingredients at all.
Okay.
And it has become a big challenge for the pharmaceutical industry, because over time people are losing trust in the health system and are resorting to various unorthodox means of getting solutions to their health challenges. And to a large extent it affects even our economies and all. So the substandard and falsified medicines risk-based communications campaign was to create awareness that you cannot continue buying medicines anyhow. Consumers may have to be on the side of caution when they are buying these drugs. You need to be a little vigilant, look at the packaging, be curious to look at the batch number, the expiration date, the manufacturing date. Just keep that handy. You can take a shot of it and inspect the pack a bit. Sometimes if it's medicine that you are actually taking over a period of time and the branding looks a bit different, the color looks a bit faded or something, you need to just stay away from them, because you may be taking actual poison in or something that will not do anything to change your plight. So that was the kind of awareness we took upon ourselves and we also said that through this campaign we have also brought home the issue about even unregistered products, medicine, which come through some of the porous borders that we have, and through smuggling. Some of these products come in and poorly packaged. Sometimes they are put in biscuit boxes, in personal effects. They are hidden because they want to evade the authorities. Sometimes they hide them even under the spare tires of the vehicles and all. So already they come to the market in a very unsterile environment, and taking them or patronizing these products actually will lead to greater risk for your health. And I must say it has been quite a useful campaign. We took it all over the country, all the regions, to hold stakeholder engagement and press briefings on them. We have developed radio jingles that we are playing in selected radio stations. We have posters and flyers that have been published and have been distributed in pharmacies and other public places just to create the needed awareness.
What can we do to help?
Yes, so media, we so much admire the partnership we've had with Adwa TV. I must say it's a joy knowing how you are intimate with what we do and want to support our cause, which we hope that other stations like you will take a cue from this and partner with us to create a needed awareness on the dangers of using substandard or falsified medicines.
Interesting. Thank you very much. We'll go for a quick turn. When we come back, we'll continue shortly. Welcome back. Thanks so much for joining us. We're still with the FDA, and this is the year under review. We're taking a look at what the FDA has been up to throughout the year, what the good ones have been, where the shortfalls are, and what we can do to help in between. So, thanks so much for staying with us throughout. What about the street food incentive? I mean, healthy street food incentive.
Yeah, sure.
We come to work every day. We are not able to cook at home, so
exactly.
Yeah.
So the street food vending project actually is another initiative of the FDA,
Okay.
which began with some collaboration with the Food and Agriculture Organization (FAO). As a result of a lot of studies that have been conducted over the years, it has become clear that all around the world, almost half of the population depend on street food on a daily basis, especially as a result of urbanization. We are unable to stay at home. We need to be in our various workplaces, and therefore street food becomes the most affordable and reliable means of getting our meals and even our nutritional requirements. And therefore we can, as regulators around the world, we cannot just ignore their operations. It's about time we pay attention to what is happening as far as food safety issues are concerned, and give street vendors the needed support to be able to provide healthy and nutritious food for the society. So right from 2018, we've been doing a lot of studies and setting a lot of benchmarks for the implementation of this project. Thankfully, a week ago, the FDA launched the Street Food Vending Permit Initiative in Osu. We are doing this closely with the local government, and so the Kloli Municipal Assembly has been very supportive. The environmental health officers in this assembly have been able to assist the FDA to select some of the food vendors, taking them to training and inspecting their facilities and clearing them, as it were, giving them approvals and permits to be able to operate. Now, the beauty of this initiative is that it comes not only with a permit but also some star ratings.
Wow.
So as long as they are able to comply with the measures that have been set for them, they have the opportunity of increasing their star rating. So very soon, your favorite wache seller would have to have a beautifully displayed permits from the FDA.
Okay, with the ratings.
With the star rating. Okay. And they will be competing not only on taste, but also on the issues of food safety, and therefore the star ratings will tell whether you are enjoying your food from a one star,
2 star, 3
vendor
star,
or from a 3-star rated vendor, and we think that alone is going to create the needed excitement about the project and warm the hearts of people. So we hope to expand this all to the Greater Accra and even beyond. So during this season, we want the public to be on the lookout for vendors that have been able to satisfy these requirements, patronize their wares, and have the peace of mind, because sometimes the wache is nice, but you end up with tummy aches or some food poisoning because of unsafe handling. We cannot continue risking our health for some good taste. We need to keep both, and we want to use this initiative to promote this cause amongst the society. And the good news is that it is virtually free.
Interesting. We hope that people would definitely purchase this, and then we'll get the ratings. When you get to your wachi joint, you know that this is actually a 5-star wachi joint or a 3-star wachi joint. I want to skip the mobile app and talk about how to get people to stop taking tobacco and tobacco substances. How has it been? We went all the way to Insawam some time back to tell people not to engage in getting or taking in any tobacco substance. What has been the response so far?
Okay, so the nation has had to battle the issues of tobacco control issues over the years. The law, Act 851, actually enjoins the FDA to be in charge of the regulation of tobacco and tobacco products. What has been the trend lately has been with the introduction of shisha and the other means of consuming these tobacco products. The youth are gravitating towards that, and it doesn't make the story look that nice. But thankfully, the FDA has signed up to the control of illicit trade in tobacco and tobacco products around the world, and as critical stakeholders in this protocol, we are adhering to the various provisions that have been provided in these protocols. One of them has to do with the display of the pictorial health warnings, which is helping so well. So now the consumer is being warned to actually desist from it as much as possible because of the health implications it will have on them. But we have seen that if we are also able to regulate the sale of it well, then those who are trying to smuggle them into the country through unapproved routes and areas will also be more or less apprehended, and therefore reduce the illicit trade of it. As a nation, in this particular period, the FDA has begun a nationwide sensitization program. Today, as we speak, the team is in war to engage the various stakeholders, because we are talking about the role of the police service, the role of customs, the role of law enforcement, and even other health and ancillary service providers, and see how they would all be brought together to chart a way forward. And it's exciting how things went in Accra, where we had a high-level meeting on this, and various stakeholders have come on board. Ghana Health Service gave an indication that they are going to introduce tobacco counseling issues into their wellness programs, the Ghana Health Service wellness programs. Again, when it comes to cessation, people, especially in the emergence of the pandemic, these are respiratory diseases, and smokers are the most at risk. And so the studies have shown that many people have expressed their interest in quitting the use of tobacco.
But it's quite hard.
They require a lot of support because of the challenges that they face. So as a result of our stakeholder engagement, it's becoming clear that we cannot outsource the cessation support processes to only facilities that take care of the mental health issues, because for now it's one of the designated sites that if you want to quit tobacco, there are centers for cessation in these centers, but they come with a lot of stigma, and to be able to free people to be able to access this service. We are thinking about sending them all the way in the communities. So if you want to quit tobacco use, there should be other very simple means of approaching a counselor, not in a mental health facility, to be able to receive the needed support to go through it. So those are very critical. Even the from Psychological Society of Ghana came up very laudable ideas of how they can be able to support the cause, because it's a behavioral trait, and there are ways that they can allow some counseling sites to be in their offices to support people who want to quit habits.
Will we get to a stage in this country where shisha will be banned outrightly?
Yeah, those are
or
discussions.
open smoking.
Yeah, in fact, for open smoking, it is a ban.
A ban on it, yeah.
You cannot just smoke anywhere. We expect that there will be designated sites, especially in public places, for smoking. So, but then sometimes people construct their restaurants and hotels and fail to comply with this, and then you may not be able to say pull it down. So we are in discussions with the local authorities who issue these building permits, such that those who are the designation of these smoking sites will also be a requirement even before they approve the plans and all, and then it becomes easy to ensure compliance when the need arises.
Now let's move to blood donation exercise. Blood is one of the drugs that helps save lives. How is the FDA partnering the National Blood Service to ensure that we always have blood in abundance in various departments?
Yeah, so blood and blood products are considered under WHO to be medical or medicinal products, and therefore require effective regulation, just as we do for other drugs and blood products. So FDA, as part of our regulatory work in the area of blood, have responded to the call on the National Blood Bank and have committed to annual and public engagements to get blood voluntarily donated to the blood service. We have been doing this over the years, and this year we held one around July 2021, which was of immense success. We did it in Accra and all our regional offices. Many of them teamed up with the regional hospitals to embark on this activity, and we are glad to announce that the FDA this year, 2021, was able to support the National Blood Bank with a total of about 1,000 pints of blood to support our cause. We see it as our corporate social responsibility and an opportunity to raise awareness of the need to have these blood centers properly licensed to ensure the quality of the blood that they provide to the sick.
Thank you very much. But I think we have about a month to enter into the festive season. You go into the markets and you realize that most of the products that you know have a certain price have been reduced. What should we look out for as consumers?
Yeah, so we need to be vigilant. These are times that you cannot just buy things for the sake of buying them and maybe cashing on all the buy one and take two for free and all, because sometimes they become avenues to clear expired products that are in their stocks. Some may want to even manipulate the expiration date on the product, so you need to be cautious, look closely at the packaging of these products before you buy them. If it is, you need some of these products which are coming on promotional basis and you want to buy it, just make sure you don't buy too much that you'll not be able to finish consuming before the expiration date comes, because sometimes they have very short shelf life, and so just buy the quantities that you think you can use. Those doing receiving hampers, just be careful, because they tend to package these in the baskets and give them out as presents, but they are really not presents. They contain poison. Some of these tin products too may be dented, and therefore they affect the quality and safety of the content. So there's not the time to be buying the dented milk or other tin fish or tin meat products. because you
don't know what
even
you're
if the
eating.
expiry date is still intact, the quality has been largely compromised, and you can be at risk. So that's our word of caution to the public. If it's expiring on this date, then you make sure you consume it before. Then if it is best before, know that the manufacturer is not able to or will be unable to guarantee the quality and safety of it after that date has been that date that has been indicated. So you need to be cautious when you have to consume this product.
Okay, so what should be your, what should we expect from you? What are your projections for the coming year?
Yeah, so the coming year we trust will be an opportunity for the small and medium scale businesses that have been badly hit as a result of the pandemic to rise. And so we are going to intensify our work in the progressive licensing scheme to get a lot more locally manufactured products to comply with the regulatory requirements. We hope and trust that in as long as they are able to pass our regulatory conditions and requirements, they will be fit for the market. They can make it to the A-rated supermarkets in the nation and even across the world. Remind you, we have the ISO certification to guarantee quality of the processes that these products go through. Again, we are introducing the online platforms for registration.
Okay.
So now people have to come all the way to our office here in Accra and the regional offices to register their products. But exciting times are ahead. It will just be a matter of pulling your phone and putting in the necessary details, and then your application is sent. You can then send a courier service to deliver your samples if there is a need, and then you receive your certificates also electronically. And that would be a very critical milestone for us because it will reduce the turnaround time that we use to even vet these applications for registration and make regulation a lot more easier and attractive to the industry.
How do we contact the FDA?
Yeah, sure. So FDA is at the doorstep of every institution by way, of everybody. And we want people to reach out to us through our hotlines, 055-111-2224 or 055-111-2225. And we'll be willing and ready to come in and assist you in any way. If you have seen anything that is happening by way of manufacturing of some unregistered water or product anywhere in the neighborhood, the one that ends with 4 is actually a WhatsApp number. You can take shots, give us sufficient evidence for us to be able to go out there and apprehend the culprits and keep our nation safe.
Will prosecution take place?
Come again?
Will prosecution take place after we have?
Exactly. So for normally we warn those who offend the law, who are first-time offenders, and then we have administrative fines that we impose on them. But for repeat offenders, they can be sure the prosecution will have its way with them. A number of them are already going through that, and you don't want to be one of them. Thank you.
So what will be your final words to us and then to the general public?
Yes, so we say Afishapa to everyone. It has been a challenging year, but God has seen all of us. So we should make merry, but have a merry with caution in mind, to stay away from unregistered products, and for manufacturers who choose to air on a registered advertisement, FDA will want to serve a warning to you that next year will be a lot more vociferous on those who choose to offend the law.
Thank you so much for your time and for your education. Viewers, you heard Mrs. Rhoda Appiah. She's the Head Communications and Public Education Department of the Food and Drugs Authority. Thank you so much for your time. We'll come your way same time next week, Monday. Before then, enjoy the rest of our programs.